Come in.
Hello, Sean. How are you doing today?
Not bad, you?
Good. So I'm going to be doing a full head-to-toe assessment on you, and I plan on recording this for educational purposes. Is that okay?
Yep.
Okay, good. So I'm going to ask your full name and date of birth.
Sean Breslin and 7/11/97.
Okay, good. And I'll start off by asking, do you know where you are?
The hospital.
Do you know the date?
12/3/17.
Yep. And do you know who the President of the United States is?
Donald Trump.
Good. So patient is alert and oriented times 3. So I'll ask you to stand up for me and walk to the table and back. So gait is good. Patient does not show any signs of wobbling, but maybe a slight limp. Did you have injuries to your lower extremities?
I did. I hurt my feet.
Okay. Did you see a doctor for that?
I did.
Okay, good. So I'll check those out again when we get around to it. So I'll ask you to stand with feet shoulder width apart. Close your eyes. Okay, so balance is good. Patient passes the Romberg test. So you can open them now. I'll next have you turn around for me. And I'll have you take a deep breath in. Okay, so chest expansion is good. Fingers were separated at least 1 inch. Can I have you bend forward for me, almost as if you're diving into a pool? Okay, so clavicles aren't sticking out on either side. Scapulas, aren't sticking out on either side. I'm assessing the spine for curvature. Any signs of scoliosis? That does not appear to be there. Spine is. You can stand up now. Spine is straight. So can I have you turn around and look back at me? So patient's posture is good. Shoulders are symmetric. Doesn't appear to be using any sort of accessory muscles. Good, so I'll have you sit back down for me. Okay, so I'll start off next by assessing the overall skin integrity. So the skin color is correct for the patient's ethnicity. I do not see any signs of masses, moles, lesions, anything to be concerned about. The head is centered and the correct size for the patient's body. The ears, eyes, nose, and mouth all appear to be symmetric. The nose doesn't show any signs of a deviated septum. Those are all placed correctly. So I will now put on gloves to assess the hair. Can I not do that? All right. So looking at the hair, I see even distribution. I see good color. Okay, I don't see any signs of alopecia, good distribution. And no signs of infestation, no lights, anything like that. So I'm going to remove my gloves. Okay. And again, looking at the face, I can tell the temperature is good. The moisture is proper. The skin is dry, but not too dry. I can see the eyebrows don't have any signs of infestation. Good distribution. Same with the eyelashes. So I'm going to take a look at your eyes, and I'm going to ask you to follow this pen light for me, okay, with the tip of it, without moving your head. Okay? Okay, and I'll have you look straight ahead for me. So patient's eyes are about a 5 in diameter, 5 millimeters in diameter. which is normal size. So I'll have you look straight ahead for me, right at the camera. Good. So pupils on both sides reacted to the light, shrunk about 2 millimeters. So the pupils are equal in size, reactive to light, round, and they both accommodate. So next I'm going to look at the sclera. The sclera is nice and white. The irises are good in color. They're even on both sides. Pupils, again, are a good size. I'll have you look up for me. Conjunctiva is a nice pink mucosal color with no signs of drainage. So next I'm going to assess the patient's ears. Looking at the ears, I can see there's no signs of drainage. Have you had any troubles with ringing in the ears or pain or anything like that?
Nope, none.
Okay, so again, I don't see any signs of drainage. So I will now whisper words on either side, and I'm going to ask you to tell me what they are, okay?
Okay. Flower. Lamp.
Okay, so patient's hearing is good on either side. So next I'm going to look at the patient's nose. I do not see any signs of drainage. Have you had any troubles with smelling at all?
Nope.
Okay. So I'll have you close one nostril for me and breathe in. Other side. Good. So patency of the nares is good. There's air flowing in. Doesn't seem to be any signs of obstruction. Next, looking at the mouth, I will don another pair of gloves. Okay, so looking at the mouth, I can see right away the lips are a good pink color. There's no signs of cyanosis, no lesions, good moisture. So I'll have you open up for me. So looking around, I can tell there's a nice pink color in the gums. The whole inside of the mouth is a good pink color. There's saliva, good hydration. The teeth, no signs of any dental cavities. They're good, nice and white. Open up one more time for me. The tongue is a nice pink color. Again, nice and hydrated. Can you lift it up for me? Good. Looking under the tongue, I do not see any signs of skin cancer, no lesions or anything like that. Can I have you stick out your tongue for me? Say ah. Okay. Uvula is a nice M shape. The tonsils are there of normal size. No reddening, no white patches or swelling. Okay. So removing my gloves. I'm going to now check out your facial muscles. So I'll have you raise your eyebrows for me, scrunch them, blink a few times for me. Can you puff out your cheeks, stick out your tongue, move it side to side? Good. And can I have you smile, frown? Good. So facial muscles and cranial nerves are good in the face. Can I have you shrug for me? Okay, good. So everything there looks good. I'll next palpate the lymph nodes. So I'm looking for any signs of tenderness, inflammation. So tell me if you feel any pain or tenderness. Yep. So feeling the preauricular, postauricular, the submandibular, the supraclavicular, and one more right here that I can't remember the name of. So, those are good. I'll have you take a swallow for me. Any difficulties there?
Nope.
Okay. I'll have you try again with a bit of water. Okay, no difficulty still there?
Nope.
Okay, so can I have you look up for me? Okay, trachea is nice and centered. Swallow one more time for me. Okay, I do not feel the thyroid, which is good. Okay, so I'm next going to feel for the carotid artery. Pulse is normal there. That's a +2. I'm next going to feel the radial artery. Pulse is good there, +2. Dorsal, pedalis, and tibialis posterior. Okay, good. Next, I'm going to assess the strength in your upper and lower extremities. So can I have you, actually first I'm going to test your range of motion. So what I'm going to have you do is sit up straight for me on the edge of the seat. And can I have you make a circular motion with your arm? Okay. No signs of crepitus. Can I have you go the other way as well? Okay, no signs of crepitus there. Same thing on this side. Okay, and forward again one more time for me. Okay, so no signs of crepitus there. Same thing on the elbows, either side. Can I have you flex and extend them for me? Okay. And can I have you flex and extend your wrists, fingers, make a fist, straighten them out, and then put them together. Good. So those all appear to be good in the upper extremity. So and I'll next assess the strength in the upper extremities. So I'm going to have you put your arms like this. Can I have you push against me? Good. I'll have you pull towards you. Good. I'll have you push up against my hands. Good. Push down against my hands. Good. And pull your elbows towards you. Good. And away from you. Good. And one last one. Can you squeeze my fingers for me as hard as you can? Good. Okay. So muscles are a +5, which is good, which is normal. I'm going to now listen for lung sounds. I'm listening for any abnormal sounds. So each time I move the stethoscope, I'll have you take a deep breath in and out for me.
Yep.
Okay, and from behind, I will check the 6 other areas that need to be listened to. Okay, so lung sounds are normal. No signs of wheezing or bronchi or any sort of obstruction. I'm now going to check out your heart sounds. Okay, I'm going to start off with the diaphragm of the stethoscope, listening for each heart sound. So I'm going to check the aortic, listening for a love dove in each area. Pulmonic. Okay. Erb's point. Tricuspid. And mitral. Okay, I'm now going to switch to the bell of the stethoscope. Heart sounds were heard in each valve. So now with the bell, I'm going to be listening for any sort of arrhythmias or murmurs that I should be concerned about, any extra sounds. Okay, so there's also no signs of murmurs as well. Everything sounded normal there. Again, I listened aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, so I'm going to have you lay down for me. Okay, and we're going to finish up with the lower extremities. So I'm going to have you flex your knee for me. Good, extend it. Same thing with the other side. Okay, can you raise up your leg? Put it back down. Good, other side. Good. Can you flex both ankles? Okay, any difficulties there?
Nope.
Okay. So I'll next test the strength. Can you push up against my arm? Good. Same thing with the other side. Good. Can I have you lift them both up for me? Can I have you press against me? Good. Can I have you push against my hand with your foot? Other side. Okay. And good. So also with the ankles and the toes, I'll have you flex your ankles and flex your toes. Okay. Good. So you were telling me about your foot injury, so there are signs of edema.
Mhm.
Okay, and you said you've been with a doctor.
Yep.
Okay, good. So I'm now going to assess the your hands and your legs and your arms. So I'm feeling for a proper temperature, good moisture. It's dry but not too dry. Same with the hands. Okay, it's a good color. I'm going to check capillary refill on both sides. They're both under 2 seconds. I'm also checking the nails. Do you feel any tenderness or pain here?
Nope.
So no signs of clubbing. Okay, you can put those back down for me. I'm now going to assess your legs. Okay, so I'm going to pull up your pant leg here. Again, I'm feeling for good temperature, moisture. It's dry, not too dry. I don't see any sort of lesions or bumps that I should be concerned about. Other leg as well. Same thing. Okay. Good moisture, good temperature, all of that. One last thing. Can I get your hand one more time for me, please? Turgor is good. Skin is nice and elastic. And again, I don't see any sort of lesions or cuts or moles or anything I should be concerned about in the arms. So, lastly, I'm going to inspect the abdomen. So I'm going to immediately look at the precordium. I don't see any concerns there. The abdomen is flat. I'm going to, or I can see that there are, again, I'll actually lift up your shirt if you don't mind. Okay, I can see that a lot better now. The precordium is okay. The abdomen is flat, a little indented, which is normal. I don't see any sort of cuts or lesions or masses that I should be concerned about. So I'm next going to listen to vowel sounds in all 4 quadrants. I should hear vowel sounds almost immediately. But if I don't, I would listen for 5 minutes and expect sounds every 5 to 20 sounds every minute. Okay, so vowel sounds were heard right away. Next, I'm going to listen for vascular sounds. I'm going to start off by listening to the aortic. I'm listening for any sort of bruits or heaves, any swooshing sounds. Okay, and next I'm going to check the renal. Show up here. Okay, no adventitious sounds heard there. Lastly, I'm going to palpate the abdomen. So I'm feeling for any sorts of bumps, any lumps, anything of concern. I don't feel anything there. Okay, next I'm going to deeply palpate the abdomen. I'm looking for any signs of, I also don't see any signs of retention. So I'm also going to assess for retention with palpation and as well as organ enlargement. So tell me if you feel any sort of pain or discomfort there. Okay, belly is soft, which is normal. I don't feel any signs of organ enlargement or distension. So you can put your shirt back down for me. And I'm all set here. So is there anything else I can get for you?
Nothing. That's
Okay,
it.
thank you.
Thank you.
What's your passcode?